So personally, I left Burundi when I was still a student in high school. A lot of trauma in refugee camps. For new refugees coming to the US, everyone is new. And with the little English I spoke, or I still speak, it wasn't easy.
So HealthPoint is the healthcare home for the majority of refugees resettled in the South King County area. Coming to a new country is already difficult, and when you have to be socially distanced, it's really hard to feel welcome. A lot of the resources that people might use were closed. Transportation is a huge issue. How do you get places? Even for someone like Jean Pascal, who speaks multiple languages, has worked as a journalist, it can be difficult to transition to a new country, to establish a new home.
I was applying to every kind of job and was called for interviews. It was too difficult for me. I didn't know even which bus could lead to which way. I remember a time I went to Renton and it was really heavily raining. So when I went off the bus, no one I could ask about the direction, telling the interviewer that I'm on my way. I had to take shelter somewhere, waiting. And after almost 30 minutes, I really surrendered. I told him, it seems I can't make it. I had to come back home, I could say empty-handed, and that was the most difficult time. HealthPoint was the first place I knew by my own.
We're really set up to be a welcoming face to newly arrived refugees. So I think we have a lot of dedicated staff and providers who want to give people a really great experience, who recognize that refugees bring a lot of benefits to the community, and want to provide a safe place and a safe start for people who have suffered a lot of trauma.
So I like the HealthPoint because they are good and nice to us. When you book an appointment, they are so helpful. They listen to you and they attend to your needs.
We have our connection desk that helps connect people with needed resources, which could be household items, clothing, food resources, connect to childcare services.
The pandemic arose when I was almost 2 months at my first job, so I was first to be laid off. So we kept praying that the pandemic would have gone, but what scared me was I had no one to pay rent for the family house, and I was afraid maybe one day we would be kicked out of the house. I kept searching for a good job. Connection desk were looking for a job for me. She was willing to help me, and I feel maybe I am not alone. I like my new job. I feel more helpful to my community members. Our job as social health workers is serving these people who probably have no one. Sometimes I feel comforted when you have called someone, you ordered groceries for him or her, and she calls you back and says, "Oh, thank you so much. My children were dying."
Having someone like Jean Pascal be able to be the face of public health, to offer services, is really important because we need trusted people in the community. We can't do this work alone. You make a greater impact if you're able to speak the same language and build trust.
This position helps me show that maybe I'm helpful to someone, even though I don't know them physically. But someone somewhere is saying, thank you.
So if anything, COVID has taught us that we're all connected and that our ability to survive this pandemic only comes from our ability to work together. Jean Pascal and his family are a great example of how when we help one person and one family be healthier and allow them to grow and thrive, that there's this big ripple effect that allows our entire community to be healthier and stronger. We are truly healthy together.